Hello Ella, it's nice to see you again.
Hello, Dr. Rozakis.
And what brings you in to see me today, Ella?
It's this little spot here. It irritates, very much so, yes.
Yep. I see what you're talking about, Ella.
Yes.
How long have you noticed it for?
Maybe a few weeks.
And has it been changing in size, Ella? Has it been getting bigger?
Not that I've noticed, it just irritates. I just want to scratch it.
So it's quite itchy?
Yes, yes.
Have you noticed any bleeding, Ella?
None whatsoever, no.
And has it changed in colour?
I don't think so.
No. Ella, have you noticed any such spots anywhere else?
No, definitely not. No, that's just the one that I just want to scratch.
Sure, I understand. Ella, have you had any skin problems in the past?
No.
No.
Just turning brown in the summertime.
Yeah. No worries. Ella, I might have a little look at that if you don't mind.
Right.
I see what you're talking about, Ella.
Do you?
Yeah. It seems very, very dry on the surface, so I can understand it's very itchy. Have you been putting anything on this spot, Ella?
I just put Nivea cream. That's my makeup more or less.
Sure.
That's all.
No worries. Ella, I'll have a little closer look at that in a moment.
Yes.
But what I'd also like to do is ask Murray Vaughan to take a little photo and send that via telemedicine to our dermatologists.
Yes.
This means that you don't have to travel, and I'll obtain a report from the dermatologists and they'll provide me with their provisional diagnosis and we can go from there. Well, what do you think about that?
Yeah, that's good.
Terrific.
Hello Ella, how are you? It's Mari.
Yes. Well, I'm worried about this little spot here.
Yes, Packy's told me about that. And
Dr. Rozakis said it would be best for you to have a look at it.
Yes,
take a
I can do
photograph
that.
of it.
Yeah. So obviously it's concerning you a little bit.
Yes,
But
yes.
Packy's already said to you that she's not a bit concerned. But just to make doubly sure, we're going to send that off to a dermatologist.
Yes.
And I'll take a photo today and have another good look at it. And they will have a look at it and determine then whether there's any further follow-up that's needed. Probably not at all. But the good thing about it, it gives you peace of mind that there's nothing else to be done. So I'll have a look at that now. And this little device takes a photo and I can upload that to the computer, send that off to the dermatologist, and then we will talk to the dermatologist later when they make an appointment for us to see them. They'll describe exactly what it is and what we need to do, and they'll also send a report to Packy. Okay? So I'll just have a look here. Yeah, that looks just a bit like a sunspot, doesn't it? And you've got fair skin. Great. Yeah, no, that looks good. So click, that's gone off. And I'll make an appointment with you in about a week and we'll talk to the dermatologist about. So there's no other skin issues?
Nothing.
You're moisturising your skin. What do you use?
Nivea.
Nivea, all over your body?
No, not quite.
Yeah, so it probably is
I couldn't
good.
afford to.
Well, we can give you Sorbeline to do that, so you don't need to afford it. And the other thing is, she was saying that gets dry and scratchy and itchy. The good thing about moisturising is that you don't get those little annoying rough bits that you want to scratch at. So that's the beauty of moisturising.
Oh,
keeps your
that's
skin, so it is a good
yes.
thing to do, and it makes your skin less liable to tear or to get sort of irritants from soap and stuff like that. If your skin's well moisturised, it gives it a protective film.
Right.
So I'll see you when I hear from the dermatologist, and they'll talk to you just over the computer. And so we can do that in your room if you like, or we can do it up here, whichever suits you best.
Actually, whatever suits you best.
Oh, thank you. Telehealth is a real benefit in aged care. As you'll probably be aware, most older people have some issues with mobility and negotiating traffic and at busy times of the day. So if we can have a virtual hookup with a specialist, that saves them the added anxiety and discomfort associated with travel, and we get access for the GPs, quicker access to specialist care. It's very hard to get a specialist generally to visit to aged care, and it's quite expensive.
Dermatology is extremely important for our elderly patients, as Mari has explained to you. From a doctor's perspective, we like to exclude any malignant lesions as soon as possible and not neglect or ignore them. So dermatology is one of our main areas of concern here in general practice. I love working at the Freemasons, and I've been here for about 3 years. We have 5 general practitioners, and we're supported by geriatricians, pharmacists, occupational therapists, physiotherapists and dietitians, so an extremely well supported team. Job satisfaction here at the Royal Freemasons is extremely high. Our patients vary in their medical conditions, they are highly interactive, they're still very much engaged in their own health. They have a future that they're very much looking forward to enjoying in a most healthy and positive way. So it truly is very, very enjoyable work. Recently, the Royal Freemasons has become affiliated with Monash University. We have final year medical students coming to the Royal Freemasons during their aged care rotation. So this provides an opportunity for doctors of the future to become very, very familiar with the problems of senior Australians.